Dr. Chen, will you just do a little mini bird walk or segue for us? We hear all the time as patients, vitamins are important. Vitamins are important. You got to take your vitamins. But we've kind of heard that for our entire life. After bariatric surgery, though, that takes on a whole new meaning, and especially vitamins that are formulated for bariatric needs. Can you kind of explain or just talk to us about why it is so critically important that we really do take our bariatric formulated vitamins after surgery?
Yeah, vitamins are extremely important. Vitamins are essentially lifelong. The reason why it's so important after bariatric surgery is one, we're getting less calories. We're getting less calories. We're getting less things in, right? So we have to make sure we're supplementing for, every patient knows the protein comes first. After protein, there's not a lot of room for all the fruits and vegetables that we normally have eaten, right? So we want to make sure that we're balancing things out, that we're supplementing to sort of account for the decreased portion sizes and the decrease of fruits and vegetables that we normally take. With some of our surgeries, there is a malabsorptive component, as we just discussed with the duodenal switch, with Roux-en-Y's. We bypass portions of the small intestine. Those bypassed portions of small intestines might have been responsible for the majority of our iron uptake, the majority of our fat-soluble vitamin uptake. And because we bypass these portions of small intestines, we got to make sure we're taking the vitamins to account for that. So vitamins are super important, and I always recommend a bariatric multivitamin, mainly because I know what's in a bariatric multivitamin. Those bariatric multivitamin, the percentages of the vitamins A, D, E, and K, the vitamin, the calcium, the biotin, etc., those are all sort of measured based on the guidelines from our ASMBS guidelines based on best dietary practices. That's not to say for a sleep patient, they can't take a prenatal multivitamin or sort of generic sort of multivitamin. And I know a lot of patients do. And I'd rather have them take something rather than nothing. But the bariatric ones are always going to be sort of safer in making sure that we are completely supplementing the things that we want. When it comes to DS and SADIES, I really, 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 really strongly encourage people to take a special multivitamin for those more malabsorptive or more metabolic surgeries, because the regular multivitamins probably aren't just going to have enough, levels of the vitamins that we need.